Welcome to the QC FitFest podcast. I'm just Joni, joined alongside with Chris Maltsburger. We are getting so excited for Saturday, September 11th for our first ever QC FitFest Health and Fitness Expo. Chris, tell me one of the things you are most excited about.
Oh, that's tough. That's like asking me what my favorite movie is, Joni. There's too many things that's out there. Everyone's going to have their own flavor, I guess, that they're going to like about this expo. Me personally, I'm very excited about having a couple of former NBA players coming in, and they're going to be shooting baskets with the fans as they walk by. I'm also extremely grateful that the Iowa Army National Guard, our title sponsor, they're able to bring in their rock wall and the inflatable obstacle course, so that way we have a kids zone there. And I just a little bit of everything. And also more important, the most important thing for me, the thing that kind of, I guess, jump-started this whole thing is the educational side of things. I want to learn what is right here in our own backyard when it comes to health, fitness, athletic performance, and all the amazing services that people in our area provide for the community.
Yeah, I agree. And I'd say in addition to that, because I know you're excited about this as well, is, watching our vendors interact with our community and looking at all of the opportunities that we each have to learn more. So yeah, I love it. I cannot wait for this event. It's been something we've been planning and working really hard on. And so, thank you for not only providing the opportunity for me and our team, but also for the Quad Cities to kind of be able to get out there and share.
Absolutely. Well, it wouldn't happen without the team, and it wouldn't happen without all the vendors that's going to be taking place. So, anybody can have an idea, but it takes the whole team to make things happen. So this really is one of those it takes a village type moments.
Absolutely. Well, we will see you Saturday, September 11th, downtown Davenport at the River Center for QC FitFest. And one of our interactive vendors is joining us right now, Dr. Kortni Richards with IMS Chiropractic in Clinton. Welcome to the QC FitFest podcast.
Hello. Thank you so much for having me.
Yeah, we are so excited that you joined our mission in not only helping educate Quad Cities and surrounding areas on what's good for their health and well-being, but we are also really excited to learn more about what IMS Chiropractic is. Now, it starts off as a real easy question here. What does IMS stand for?
So IMS stands for Integrated Muscle and Spine Chiropractic, but it's kind of a mouthful, so we just shortened it to IMS.
Yeah. So what does that mean? I mean, for an average layperson, if we were to come to your clinic, what could we expect?
So we focus a lot more than just adjustments as some chiropractic offices do. It's called the musculoskeletal system for a reason. And just because we got your joints working properly, again, doesn't mean that muscle's happy and working properly. They just play off of each other to be able to move and function properly. So we hit a little bit of both through several different techniques like ART, Sfma, just trigger points, whatever it takes, because every person is different. But ultimately, our goal is to just get that function moving properly again, just getting that joint working how it should be.
Now, one thing that so Dr. Kortni, I was on your website earlier, and one thing that I kept noticing was the initials Sfma. Can you let our listeners know what does that stand for, and what exactly is that procedure or technique all about?
So Sfma is a functional movement assessment. So there's times that your body you think you're moving properly and functioning properly, but you're really not. And the assessment breaks your body down in all different regions to figure out what is actually not moving properly. Because if, say, like your back, your thoracics aren't moving properly, other things are eventually going to get affected to make up for that movement. So it really just narrows down what is the main cause of what is not functioning properly. So like if your thoracics aren't functioning properly, pretty soon your shoulder and arm are going to follow suit.
And that's crazy. That is crazy to think. I mean, a lot of people don't realize that it's kind of like, that little snake toy, you flick the wrist to the middle part and everything else kind of goes out of adjustment. Do you remember those toys at all?
Oh yeah, I remember them.
Okay. I was like, am I the only old person? Am I like showing my age? I feel old. But I think that's a really great, accurate representation of the spine. So like if you have one area or one region of the body out of whack, so to speak, or out of alignment, then it greatly affects the other areas of the body. So like, Dr. Kortni, maybe you can talk through this with me. If your hips are out of alignment, a lot of people don't realize that having like a tight psoas muscle not only stimulates the vagus nerve and kind of puts you into fight or flight on a constant level, but it can also create all kinds of knee pain, which affects your ankles, which, it just all has a trickle effect.
Oh, 100%. Especially like people don't realize is your low back muscles are supposed to work in conjunction with that psoas muscle and your hip flexors. Like that's how we keep our balance. That's how we stand up straight. And sometimes those muscles will start playing tug of war with each other. And then eventually your upper back will go out to make up for that. Your knees will go out, and then eventually your ankles, and even vice versa. Like people don't realize if you fall and land on your hand, that pretty soon if those biomechanics in your hand are messed up, the elbow's going to follow suit, the shoulder's going to follow suit. Now your neck and upper back is going to follow suit. Same with ankles. If you twist your ankle, your knee is going to eventually follow suit, then eventually the hips and the back.
I feel like you just did an amazing job explaining the song that I grew up listening to, the knee bone's connected to the backbone, right? So I think that's what just happened right there. I just got educated on a whole other level. So Dr. Kortni, one question I always like to ask people is I'm all about the journey and the path of people. How did you get into this? How did you get into the chiropractor field? Where did you go to school, and what led you to, are you from Clinton, or what led you to Clinton to join IMS?
So I'm originally from the California-Arizona border and Nevada. I got into chiropractic because I was a USA swimmer and playing club swim and playing high school volleyball all at the same time. And I got to a point to where I had such intense shoulder pain. I was eating Motrin like candy. Nothing was working. I couldn't finish practices anymore. Every doctor that I went and talked to, it was, well, we don't have a diagnosis, but we can do exploratory surgery to figure out what's going on, or MRIs and all this stuff. And I was like, not having surgery unless it's life or death. That's just how I am. And
absolutely.
Yeah. And finally got introduced to a chiropractor. I didn't know what a chiropractor was. And they actually ended up adjusting my first rib and my shoulder blade. And after that, all my pain went away. I could practice normally again, everything else. And I sat down one day and thought about it. And I wondered how many people are getting unnecessary surgeries or medications with something that could be fixed with naturally, like chiropractic.
Right. And maybe even how many people are on, loads and loads of painkillers too for it, when really it's the function that matters most.
Oh, 100%. And that was what really got me into and driven to become a chiropractor and everything else was I wanted to help people. And yes, there's a time and place for everything. There is a time and place for medications and surgery, but if we can avoid it, why not?
Right. Because emergency medicine is amazing, but being pharmaceutically, I think we're not really born deficient with some of those things in our body. So if there's a natural way that's non-invasive, for instance, non-surgical, and a way that we could even, help people to bring their body back into alignment and balance, then, why not give that a try first? The educational aspect of how our bodies work in tandem, like how it all works together. We've still got a long way to go when it concerns teaching people exactly how their bodies function as a whole organism.
Oh, 100%. Yeah.
Now, Dr. Kortni, just go ahead if you wanted to elaborate, if you want to expand on that.
Nope, you were good. She did a good job of it.
She always does. Yes. So, yes. So she does such a good job. It makes it hard for me and my questions sometimes. So, but yeah, you know what? Another question, kind of to add on to the journey and the path of everything. Out of my own curiosity, how many doctors do you have there in your office? And do you guys each specialize on a certain thing, or do you all kind of collectively know the same skill sets, I guess?
So there's me and Dr. Woodward, and Dr. Woodward actually works with the Hawkeyes Wrestling and travels with them.
I seen that, by the way, and I don't want to cut you off, but I seen that. I was actually going to bring that up, and that's I'm going to have you expand on that a little bit later on, but go ahead and continue.
So yeah, there's both me and Dr. Woodward in this office. And for the most part, we are trained in some of the same stuff. He's a lot more trained in like the ART techniques, which is active release. I eventually will be. I'm still working on those. But for the most part, we are trained in the exact same stuff. The only biggest difference probably between me and Dr. Woodward is he's also certified in acupuncture. So he does both regular acupuncture and grafting acupuncture.
Oh, very cool. So someone could come in there and get an adjustment and also get acupuncture done as well.
Oh, yeah. And then
very
eventually
cool.
we want to bring in a massage therapist and physical therapist, but that takes time and money. We're getting there.
Absolutely.
Slowly.
As does everything. So yeah, so now you kind of let the cat out of the bag. This was going to be something that I was going to bring up. You had said that Dr. Woodward is now is it safe to say the official chiropractor for the Iowa Hawkeye wrestling team, or just one of?
One of.
Okay, fair enough. And that is so that is so impressive because for anybody who knows anything about wrestling, you know that Iowa wrestling is the mecca of wrestling. Dan Gable, again, if anybody who knows wrestling, Dan Gable, who coached the Iowa Hawkeyes wrestling team for years, is like looked at as a god in the wrestling community. He is there wouldn't even be a Mount Rushmore unless he was on it. And so that's pretty impressive. And I know there's a lot of listeners and a lot of fans who are going to be attending this event who are massive Iowa Hawkeye wrestling fans. So that's pretty impressive. And how did they get that? I guess that contact. Like, how did that even happen?
To be honest, I don't even know. And I think it's mostly because I come from an area where wrestling isn't a huge thing. So I've always been like, oh, you're the wrestling coaches or part of the wrestling team. Like, you're one of the chiropractors, and kind of just left it at that. And I think it's just more of my own lack of interest. But
sure.
I've been doing it for years. He's there for most practices and stuff as well.
I love it. Well, that like I said, that's very impressive. Coming from an area where wrestling is very big, that's extremely impressive to have that under your resume.
Well, Dr. Kortni, I was impressed to hear that you were such an athletic swimmer and so competitive. Did you, after those adjustments and getting the function back in your shoulder, how far were you able to take your swimming career, and share a little bit of a story with us about you in regards to your athletic career?
So I was a huge swimmer. That was my biggest thing. And I was part of USA Swim all through high school. And I was getting ready to start my freshman year at Cal Baptist University in Riverside, California. And literally like the week before we were supposed to start practice our freshman year, I kind of hit and burnt out. I was just kind of done. And I actually didn't swim at all for my college years. And I decided at the time that I was burnt. I overtrained myself, and I'm not gonna, my plan was never to become professional with it to begin with. So I was like, my main focus is going to be into school and to become a chiropractor and help people. I'd rather do that than spend all this time swimming for it to just end when I graduate.
Right. And wearing your body out is super. I mean, the burnout rate is pretty high, especially when you're not really taking care of yourself. Were there any nutritional or supplemental programs or, supplements that you took or, nutrition that you had, that you used, that you found would really help your body not only, fuel for matches, but also recover? Honestly,
I wish I knew as much then as I did today. I really came from no background of nutrition or anything like that through high school. My parents were very athletic, so most of my stuff was self-taught. Even when it came to weightlifting in the gym, I was actually being trained by the high school football coach because I grew up in such a small town of very limited opportunities, and I really wish I knew then what I knew now.
Dr. Kortni, it sounds like you needed a QC FitFest in your life.
I did.
I love it. Well, hey, we don't want to take up too much more of your time, Dr. Kortni, but what I will say, I appreciate you taking the time jumping on. How can people follow you? Do you have anything else going on? Is there anything you want to plug? Now's you're open floor to say whatever you guys want.
I mean, biggest thing we're looking forward to next is QC FitFest. I've really started trying to integrate or practice more into things in the community and stuff since I've started. And I'm very active on our social media. If you guys want to follow us on Facebook, I'm constantly updating if we have openings, tidbits of information, tips, tricks about nutrition. Just very little things, just always trying to help and teach the community with what I can or what things may help them with in their everyday life.
And how can people follow you as far as on a website? On
our website, I wish we were more active on our website than we are, but our website is leaked on our Facebook. Our Facebook is probably our best way to reach us or find out any new information.
That's amazing. And, a lot of people are kind of tending to move towards social media anyway. So, yeah, go ahead and find IMS Chiropractic in Clinton on Facebook. Dr. Kortni, thank you so much for joining us today on the QC FitFest podcast.
Thank you so much for having me.
All right. We're looking forward to seeing Dr. Kortni and her team at IMS Chiropractic at the QC FitFest. We're looking forward to seeing you there at the QC FitFest. It's just $10 at the door, $5 for kiddos 13 and under. Head over to qcfitfest.com for more information. And we will see you Saturday, September 11th, downtown Davenport at the River Center.